As we enter the summer of 2010, the Ontario Nurses Association believes the union and its members should anticipate a challenging fall as we fight for quality patient care. At the March Provincial Coordinators Meeting, ONA leaders shared information and experiences about the effects of nursing cuts on the workplace and on patient care. The trend of replacing registered nurses with registered practical nurses is driven by cash-strapped employers as they attempt to balance their budgets.
At the same time, they're talking about increasing the acuity of our patients in the hospitals. They're talking about reducing NPs. We've had 5 notices of nurse practitioners laid off, which is very interesting because the NPs are kind of the new supported nursing structure, and RNs. And sometimes the jobs are just gone. Sometimes the jobs are being replaced with less skilled workers.
Guest speaker Tom Clausen, President and CEO of the Ontario Hospital Association, presented the OHA's strategic plan.
We've got 24.7, 21.1, and 19. It's $65 billion worth of accumulated deficits over those 3 years. We sort of have to figure out how in the world are we going to move forward to still provide good care to patients over the next number of years and move towards a balanced budget.
We know that the majority of any nursing initiative money that's going out there, of any dollar amount, is to 5% of the nursing workforce. They put a few little minor things in place. They make a big splashy announcement about nurse practitioner-led clinics, not to say they're not great, but for the public, they think there's money being given to nursing all over this province. Well, 95% of us are getting ripped off, and our members know it because they know that it's impacting the care they're able to provide.
The March PCM was a launching pad for a renewed effort to fight the nursing cuts in a campaign that includes lobbying.
If our MPPs know that there is 55,000 very irate nurses and allied health professionals in ONA, they will take notice.
My message to members is to just swallow your own nerves. If you're nervous about talking to your MPP, just go ahead and do it. We're actually advocating for our membership, the people that we represent. That's my key job as a local coordinator, is to represent the members of ONA, especially in Renfrew County. And so I'm just encouraging others, just go ahead and do that. Just take that first step. The rest of it will come. We have a great support system in ONA to help you through the process, and it will make the process more enjoyable for you. It's actually, I was surprised by how enjoyable it was.
Despite the challenges, ONA members continue to be passionate and committed to their profession. Our annual Nursing Week events celebrated the profession.
We have lost over 2,000 RN positions in the last year alone. You need to join together, all of you, and be the voice for your patients and for every single nurse in this room, as well as all the ones that are back at the ranch.
ONA victories on other fronts continue. The efforts of ONA and its allies resulted in the expansion to multiple sectors of the mandatory use of safety-engineered devices. At the April 28th Day of Mourning events, we showed our sorrow for lost workers and our resolve to make workplaces safer. And again on Injured Workers' Day, ONA pledged to fight on for health and safety.
So 27 years ago, when I was a young grad as a nurse, I went into that profession like many of you today did, thinking that I was going to work hard and have a job and be compensated appropriately. And here we are today and across all Ontario, injured because of unsafe workplaces, unsafe return to work programs. So WISIP, my message to you, workers' compensation, for me to say is, you better step up to the plate. You better realize you have obligations. The Occupational Health and Safety Act needs to be considered, and we need to be supported in our return to work efforts and our payment of reasonable workers' comp benefits. Thank you.
In addition, June 15th marks the effective date of Bill 168, the new provincial workplace violence and harassment legislation. And we continue to be strong advocates for members, both in the public eye and at the bargaining table, as we look to the battle of hospital sector bargaining, which we know will be difficult. As nursing cuts continue, ONA works to prepare, educate, and motivate members to fight for quality patient care. As always, it is vital that ONA continue its efforts to remain the visible and vocal representative of the dedicated RNs in this province. Through our member education efforts, our advocacy work, and by ensuring members have an array of resources available to them through their union, we will continue to do just that.